In Ottawa, some paramedics are being moved off their regular duties because of a shortage of N95 masks. They say they can't do their job without proper protection, and it isn't clear just when supplies will be topped up. City staff say a number of masks needed by first responders are not available in government stockpiles and are currently on back order. They're trying to find an alternative source of masks that meet provincial standards. But for now, paramedics are urged to limit their use of PPE whenever possible. Joining us to talk more about this issue and other COVID-related questions, Dr. Michael Garda. He's the Chief of Staff at Toronto's Humber River Hospital. We've reached him in Prince Edward County, Ontario. Good to see you. Thank you, Doctor.
Thanks for having me.
So what do you make of that paramedic situation we just outlined in Ottawa?
That story is actually similar to what we've seen in hospitals as well. The challenge with N95 respirators is that they're not one size fits all. People need to be fit tested to them. And there's a variety of different sizes. And there's some people who have, for whatever reason, they actually fit a mask, which is not very common. And so what we've seen in hospitals as well is there's sometimes a small percentage of people who, for whatever reason, cannot get their fit tested respirator. And those people, if they need them in their work, they're not able to do their job. They have to be reassigned somewhere else.
And in a case like that and some of the other frontline workers, is it N95 or nothing else? So who really needs that level of mask?
Well, I mean, the N95 respirator is used for when we have situations where we do these so-called aerosol-generating medical procedures, where there's these fine particle aerosols that can get around a surgical mask, and the N95 respirator will actually protect them. N95 respirators are particularly important for paramedics because they're going into situations where they don't really know what's going on until they get there. And if somebody's very unstable, the situation may change very quickly, where what they thought was a stable patient into somebody who now needs to have their airway managed, and then they need an N95 respirator. So it is why they are particularly important in that group.
Are you surprised to hear that at this stage in the pandemic in Canada, we still can't get the masks that we want where we need them?
I'm not actually. I mean, this is a bit akin to having a small subset of people who need to wear size 14 shoes. They're hard to find. They're not well stocked because most people don't need that particular size. And so this is something which pops up once in a while, even actually outside of the pandemic. To me, the key thing is that we really need to secure these supply chains so that going forward, this kind of thing is dealt with and it isn't an issue anymore. Right now, things are relatively quiet, but most of us predict that they're not going to stay that way as we get into the fall.
Is there a danger that the move to make masks mandatory in many places in this country now has impacted the masks for frontline healthcare workers? Could we see that?
You know, it's always been a concern that people will try to, corner the market on respirators and wear those for their home use. I haven't seen that. And I think the guidance is pretty clear that we're talking cloth masks, non-medical grade masks, and masks have really become a fashion accessory. I don't know if you've noticed, but there's a lot of different masks out there. Yeah. And none of those are actually medical grade. So right now, fortunately, there seems to be a really clear distinction between what we wear in the hospital or what the paramedics wear and what the general public wears.
Certainly in Toronto, I've seen a lot of people wearing just a simple bandana as a mask, as a cloth mask, because we're told that that works well enough. I want to get back to something you mentioned about the N95 mask and the fit. How important is the size or the fit for effectiveness? And I know it goes tightly, it pinches tightly over the nose. Is a poor fit almost worse than wearing no mask at all?
It isn't worse than wearing no mask at all, but I mean, the whole point of the N95 respirator is that it's meant to provide a very tight seal over your face so that any breathing that you're doing the air is being pulled through the respirator rather than around the edges. And so that's the whole concept behind fit testing. And ever since SARS, healthcare workers, if they are required to wear a respirator, then they have to be fit tested to that respirator. And they have to go back to that respirator, that particular size every single time. And it's when we're out of stock of that one, then we start to scramble to see, is there something else that somebody could wear still needs to be N95, but is there a different model that they could wear? And that's kind of what's going on now, trying to find if people can fit other models of respirator.
Okay. Before you go, I do want to turn to the outbreak of COVID-19 at the Misericordia Hospital in Edmonton. We have tracking this story for a few days now, and today the news that 3 more people have died in that hospital for a total of 6, and they have a substantial outbreak there. The emergency room is even closed, surgeries canceled. What lessons can other hospitals take from what's happening there?
You know, one of the things we've seen with this particular virus is outbreaks can get very big very fast. I mean, I've been involved in several of them myself, and it's really quite shocking how quickly people can become infected with this. And one of the challenges is a fair number of people have it and don't know they have it. And so, you know, our original sort of approach to outbreaks was to test people who had symptoms. Now we're going much broader than that. We're looking for people who just happen to have been in the area, and we're finding it all over the place. The other, I think, message we've seen from other outbreaks around is that we know our healthcare workers are quite well protected with the gear that we're giving them. The problem is that when they're going into break rooms or having lunch or, you know, taking a drink of water, that's when they can get breaks in protocol. And so it really is less about, you know, coming up with new guidance and more about being very strict with that guidance, even when you think you don't need to follow it because you're not around a patient right now. That's something that we've learned here in Ontario.
That's interesting. Are many hospitals trying to implement that? I mean, if you only have one staff room on a floor for people to eat their lunch, how do you isolate?
Yeah, well, you end up trying to ask people to, you know, physically distance with 2 meters. I don't know if you've seen those staff rooms, but they're not very big. So it is very, very challenging. You know, there's a number of design issues with our healthcare facilities. They just weren't built to prevent the spread of infections like this. And so it's something that we need to learn going forward is how do we allow people to take breaks? Because they have to take breaks. How do you allow them to do that safely?
Interesting thoughts, as always. Thank you so much for your time on this Friday morning. Appreciate it.
Thanks for having me.
Dr. Michael Garda, Chief of Staff at Toronto's Humber River Hospital, joining us from Prince Edward County, Ontario.